Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Laboratorial news. This audio podcast as part of a Hella LabZtorm. This audio podcast as part of a Crowd Broader. This audio podcast as part of a Storm Robotics production. In this audio podcast, as part of peer-reviewed and published works from 2020, now looking at sort of the literature review, sort of the literature review aspects. So, healthcare scientists, for example, or allied health professionals, are involved in almost up to 80% in up to 80% of all clinical decisions in the prevention, diagnosis and treatment of a range of sort of health, a range of conditions a range of conditions through the National Health Service or NHS. And there is a traditional sense that for example, scientists, those amongst the healthcare workforce who are part of sort of the behind the scenes sort of care for healthcare service users, have always been involved in the support of healthcare teams, and providing test results in to pathology, laboratory medicine and pathology, and as part of and between sort of healthcare sectors. Understanding some of the economics in some regard, and making some and make it making and sorry and smarter working would allow sort of a better would allow better care of healthcare service users in amongst and again between healthcare sectors. Currently or presently, however, the evidence base for healthcare scientists involved in context of primary care is insubstantial. Healthcare sciences as a sort of a hidden service remains largely unchanged, and cross professional collaborative working is still or can still be sort of questionable. Um, although websites and apps such although websites and apps such as Lab Tests Online, for example, which was established in 2014, provide healthcare service users with information on the purpose of investigations, laboratory investigation, and sort of the reason for and the reason for and the reason healthcare providers by healthcare service providers. um, at the same time at the same time the time for healthcare scientists involvement involve sort of yeah the sorry the time is right for is right would be right to for scientists or healthcare scientists to identify novel ways of working and collaborating in broader healthcare. The novel tech and or POCT or NPT kits could prompt healthcare laboratory specialists to become more to become more to become a more sort of a proactive in amongst primary care environs, and to monitor and suspected or high risk healthcare service users for specific long-standing long-term conditions. Scientists not only authorize and validate and interpret results results, but also know how and why laboratory investigations are important in broader healthcare. Scientists could provide baseline explanations on the objective of tests and the specific impact of results. Healthcare scientists have a sort of a unique, can have a unique, or should have a unique role to play, and scientists need to be able to share specific knowledge in terms of that layman can understand, to help bridge gaps in public understanding relating or regarding to clinical scenarios, especially to capture especially to capture patient reported outcome measures. There is broader evidence to suggest that more health promotion in amongst the community can support the understanding of some of the complexities regarding to laboratory investigations, health and disease. In in one in a particular in one particular investigation, a triangulated research approach, three academic institutions, two health departments, and two indigenous organizations collaborated to identify workforce capacity in remote communities through and looking at sort of the education aspect. A need was observed to educate the educators in around the chronic care model, and in using a population health approach. There should be more practical or pragmatic ways to alter the acute disease based practice model that dominates in the healthcare in the health workforce towards an integrated an integrated and systematic population-based approach. This investigation highlighted that healthcare scientists have a broader role in aligned to the healthcare workforce. In research, in addition, research in other research to learn what educators across health professions involved health professions involved in primary care and primary health care think about when in line to interprofessional collaborations. One of the challenges is ensuring clear definitions of providers roles and expectations regarding shared care. Defining roles and responsibilities would enhance the positive elements of collaborative interprofessional care and reduce misunderstandings regarding protocols, procedures, responsibilities, and authority. Collaborative, patient-centric, patient-centered or healthcare service user-centered practice is designed to promote the active participation of each discipline in amongst healthcare service users for healthcare service users and sort of in line to patient care. Collaborative working enhances mechanisms for continuous communication, optimizes participation in decision making with and across disciplines, and fosters a regard and respect for multidisciplinary contributions from all health professionals, from all healthcare service providers or all professionals. Unfortunately, in the investigation, there was in the investigation there is no there is and was no participation from the healthcare science sort of or laboratory medicine workforce. Another investigation looked at it had a meta-analysis of 72 independent investigations incorporating 4,795 different teams across a range of industries, highlighted that information sharing positively predicted the performance of the team. Areas where information sharing had been shown to be inadequate are the are the sort of interface between contexts such as interdepartmental transfers. However, to improve, for example, CKD, chronic kidney disease sort of care plans, the healthcare scientist could could for example, be expanded from purely laboratory diagnostic validation to educational, thus enhancing a smarter and collaborative working. There there was a report referred to in context of primary care, but the report also focused on parts of secondary care, and the report was published by the Royal College of General Practitioners, or RCGP, and was referred to as the GP Forward Review, and this highlighted how primary care could look in sort of in future. Healthcare services, for example, healthcare service users, for example, want the educational skills and confidence to take on responsibility for health and feel in control around a sort of a set of circumstances and outcomes, channeling this sort of this channeling this for services that help patients or healthcare service users to help themselves, unlocks both a better experience and a way to alleviate practice workload. The avenue could open doors involving AHPs, allied health professionals, and more so on the front line, supporting care for healthcare service users, and the need for allied health professionals in amongst primary care to support practice on the front line, providing education relating to disease trends could become more important, owing to healthcare service users with long-standing conditions or long-term conditions being encouraged to become more autonomous. This will lift sort of this will also sort of this should also alleviate the sort of the scientific and technical burden of general practitioners. That draws this audio podcast to a close. This audio podcast as part of a Laboratorial News. This audio podcast as part of a LabZtorm. This audio podcast as part of a Kroll Boulder. This audio podcast as part of a Storm Robotics production.